Make sure you review medications with your loved ones. The more they know, the less confusion there is of what to take and what color and what shape, what size, and how many milligrams when they're just going in and grabbing things out of a pill bottle instead of their pill box, maybe that has been set up ahead of time. You want to keep people safe. Too many meds can cause confusion when you have um, for instance, Tylenol or acetaminophen, which is really huge overdose drug that's over the counter. I've seen people take too much of it before. But when you have a patient that has, or a loved one that has 325 milligrams and they say, take 2 of these, you can go buy 650 milligram pills. If you know how to stack the meds a little bit, or you can ask the doctor, instead of taking 5 of these prednisone or 5 of these other medications, like, how can I make it 1 tablet for them so that there's not 20 tablets in their pill box? Because it's easy to lose things or to misplace them, or if you're trying to take them and they fall, you know when there's 3 pills as to when there's 20 pills. And you want to make sure that you keep that rhythm going with the body, the pills that especially we need most, right? So too many meds can cause confusion. Make sure that maybe if it's a lower milligram or something, that you can talk to the doctor and say, instead of taking 5 of these pills, can we just put it all into 1 pill at a higher milligram? Number 2, side effects. Side effects can actually mimic decline in your loved ones. My uncle, one day, I went over there to visit, and he acted really confused. He said he was going to see a friend. He had his keys in his hand. He went outside, and he just, to me, was not right. He just kind of had this weird look on his face, like he just wasn't sure what was going on. He went outside, and I saw him open the car door, and he was just sitting in the car. He wasn't doing anything. And I told my aunt, I said, he's not acting right. I don't think he should be driving anywhere, And I went out there to talk to him, and he just seemed really confused. I was afraid that he was going to get lost somewhere or be driving or get in an accident or something. So, just told my aunt, I think we need to get him back in here. We called EMS. We called somebody to come out, or, get some EMTs over, and the ambulance, and they just checked him out. We were lucky because there were actually some family friends or some volunteers that lived close by. So they came over and checked him out, and they realized, yeah, he was a little bit off. One of the medications was either it was a higher dose, or it was just not metabolizing or breaking down like it should in his body. So he was reacting with too much of it in his body, and it was mimicking almost like he had some dementia going on, or memory issues. And it was really scary. And I know my aunt was very scared for him as well. But luckily, they looked at it. They found out that they could stop that medication, that he didn't even need it, that they tried a different medication that had a lot less side effects for him, and that he was able to absorb and utilize better for his body. Review medications. It prevents harm, because when people know what they're taking or why, then they're more apt to taking it. Otherwise, they may not take it. I've talked to patients before, or even my own family members, and said, if you are coming from a surgery or something that you had done, that you have had a lot of pain before or even after surgery, when you have your surgery, the surgical procedure, when you get home and you're having a lot of pain, and people say to me all the time, well, I don't want to take the oxy, I'm afraid of getting hooked. Well, they don't have you on enough to get you hooked, because you only have it for a couple of days, and you can only take so many doses a day. So you wouldn't get hooked on the small amount that they give you. But a lot of people don't want to take it because they don't like the side effects, constipation, or maybe it makes them feel dizzy or lightheaded, or whatever it makes them feel for side effects. So they don't want to take it. But the problem is, when they don't take it, especially before they go to bed, I tell people all the time, just make sure you take your med before you go to bed, because it'll help you sleep. And then it will just make you feel better, because you want to keep your pain under control. Because if you don't keep your pain under control, then you're not going to heal, because you need your sleep. And if you keep waking up because you're in pain, then that doesn't help you. So it's nice to know, just to maybe have less medications, have less pills to take, because you can figure out the milligrams and talk to your doctor, and explaining and going over medications, what they are, why we're taking them, and the side effects mimic decline is a huge one. So we want to make sure that we're watching for side effects. And less can be safer, right? Less pills can be safer in certain ways. Or even if they're not the right pills or the right medication for them, because the side effects are too harsh on their body, then we notice it, because we're the ones around them all the time. So we want to make sure that we share that, and make sure we're up on the medications and talking to the doctors to keep everything safe and injury-free for our loved ones.